Welcome to the Rise for Equity podcast. In this series, we'll be talking to leading physicians, scientists, and innovators about what it's going to take to transform healthcare for a more just, more equitable future. I'm Nicole Nfonoyim-Hara, your host on the Rise for Equity podcast, and today I'm joined by Dr. Victor Chedid. We're discussing the health disparities faced by the LGBTQI community and Dr. Chedid's work as an advocate for LGBTQIA patients, trainees, and staff in his specialty and beyond. Welcome to the podcast, Dr. Chedid.
Thank you so much, Nicole, for having me. I'm really excited to be here.
So the LGBTQI community, as you know, is really diverse, it's really intersectional, and it encompasses identities that are related to sexuality, but also gender identity and expression. And then, as I said, intersectional. So you've got faith and race, class, ability, all these things. So before we dive in, could you help us just build some shared language by defining the acronym LGBTQIA+.
Absolutely. And I love how you acknowledged, first and foremost, the intersectionality and the diversity of that community. While it is labeled as LGBTQ plus as one bucket, but it is very diverse and everybody's experiences are so different. And it is used as a term that can describe people's sexual orientation and gender identity. Many a times we use it interchangeably with the term sexual and gender minorities. And it is an acronym for different identities. So lesbian, gay, bisexual, transgender, queer or questioning. And the plus is a recognition of the diversity and that it's not limited to just these identities.
Thank you for that. Often on this podcast, we talk about how health disparities and inequity have historical roots. In terms of the LGBTQI community in the United States, what has some of that history looked like in terms of health equity?
Absolutely. So first and foremost, I always remind everybody that health is a fundamental human right. And health equity is only achieved when we all have the ability to attain the full potential for our health and our well-being. And we recognize that there are so many factors that impact people from achieving that equity, whether it is historical injustices or contemporary injustices, economic or social obstacles that people face, and other elements of health disparities that are preventable. And it all has to do with a history of a lot of stigma, discrimination, not being accepted by whether their personal community, whether in their family or on a bigger scale in their society, to prevent the LGBT community from achieving the health equity that they deserve.
It seems like a lot of layers in terms of the equity issues that are facing the community. And I love how you sort of mapped us through sort of that individual and communal and then all the institutional and systemic things as well. You talked a little bit about the impacts just generally around well-being and mental health. How does not being able to even see someone impact health outcomes, well-being, and mental health?
Let's say somebody needs to seek care for a medical condition they're facing. They have some symptoms. I go to GI because I'm a gastroenterologist. You're having symptoms of bloody diarrhea or abdominal pain, and you belong to the LGBT community. You might sit at home and suffer and not seek that care because you're afraid of the discrimination you're going to face at the doctor's office. Or if you come out to talk about your symptoms, you worry that will the providers blame my identity for getting these symptoms or for getting such a diagnosis? And so many people might delay the care they need, and they end up pushing it out till they have more severe conditions and ending up requiring more severe or drastic measures to treat their condition, or ending up in the emergency room rather than seeking outpatient care.
The story that you sort of outlined in terms of someone really suffering on their own and having to delay care and having to, I mean, the sort of the long-term impacts of that, supersede just the physical, obviously, symptoms and things. What are the barriers and biases that patients are experiencing when they're in the doctor's office, speaking with a provider that's still preventing them from getting the care that they need?
There's a lot of misconceptions, stigma that people carry, implicit biases that people carry that impact how they treat individuals who belong to the LGBT community. And so let's say you're at the doctor's office and people don't know how to talk to somebody from the transgender community or somebody who is non-binary. So they end up misgendering them. Misgendering means where they're referring to them in not their gender identity, using the wrong pronoun when they're addressing that person, or dead naming them. Dead naming means when somebody is being referred to by their birth name rather than by their actual name. And these are major, these have major impacts on an individual because particularly they feel that they're erased. They're not being honored by who they truly are. And imagine that that's happening every time you go to a physician's office or a healthcare system. You're probably going to be frustrated. You're probably going to be disappointed. You probably are going to feel that, hey, they don't care about me as a human being. And maybe I should seek my care in another healthcare system where they might honor me. But I also might even not seek care altogether because everywhere I go, I might experience such stigma or misgendering. Another thing is that at the healthcare setting, many of us can lack cultural competency in terms of understanding differences with cultures from whether LGBTQ plus related health issues or pertinent cultural nuances that are from the LGBT community. Also, going back to your initial point of intersectionality, so cultural differences with ethnicities and race, or gender difference, cultural competence. So with that said, when we lack the cultural competence and we're not training the healthcare providers and the staff at the healthcare offices on cultural sensitivity and cultural competence, that can further the stigma and further the implicit biases in the offices. And again, patients see it. People who belong to minoritized and marginalized communities feel it, see it, recognize it, and that furthers the wound that they carry.
These sort of cycles of not being recognized, not being honored and seen. And you mentioned, particularly with trans and non-binary patients, there have been national surveys that have found that these patients in particular have to be in a position to educate and teach their providers often, as you said. And you mentioned, on the sort of the provider side, some of that cultural competence. And it makes me wonder, what kind of education, if any, do providers receive on LGBTQI Health 1 training? What do you recall from your own training around this?
Well, here's the thing. Training on specifically LGBT cultural sensitivity and cultural competence can vary from university to university, from med school to med school, and from institution to institution. So there is no curriculum that is set, that is provided at institutional levels, that is quite mandated. That does not exist technically. So I recall in my med school, I went to med school not in the United States, in Lebanon. But again, we had a lot of training on societal impact and social determinants of health in medicine, and recognizing how different social determinants of health can impact healthcare outcomes. But we never had a specific curriculum on LGBTQ health. And I talked to a lot of my colleagues here who are in the United States, who went to med school here in the United States. They also did not get that training growing up now or in medical school. Now, I'm talking 10, 15 years ago. Now, more and more medical schools are incorporating such trainings in their medical school curricula, but it comes more from providers or physicians or scientists who belong to the LGBT community, who are advocating for LGBTQ health equity, and they are taking it upon themselves to be the spokespeople or the folks who are developing the curricula to implement it in medical schools. Now, I know also that again, we get a lot of training as physicians at different institutions. We got a lot of training on difficult communication skills, or things like how to prevent infections, or how to wear your mask properly, or how to dispose of needles. But we don't have, again, a specific curriculum that trains us on how to speak to LGBTQ plus individuals, what are disparities that they face, and things like that.
Oh, thank you for sharing that. And it sounds like things are changing, but there's certainly a need still for that. And
Absolutely.
um, there's also this sense too. I think for so long the mainstream health conversation around LGBTQ community has been around HIV/AIDS, which disproportionately and devastatingly impacted the LGBTQ community historically, and many are still living with that reality. But why is it important for all specialties to be thinking about LGBTQI health, and for LGBTQI health not to be reduced to a single story or narrative or legacy today?
That's such a wonderful and great point that you are making here, Nicole. Historically, just in medical school, in our textbooks, whenever they wanted to teach us about something related to HIV or AIDS, it always has to be linked to an LGBT person. And that creates further stigma. Whenever you see an LGBT person in clinic, because of how our historical training has been linking those two together, whenever you see an LGBT person, the first thing you think of, oh, do they have HIV? I'm going to test them for HIV, which is very, very flawed and very stigmatized. Yes, the HIV epidemic impacted the LGBT community disproportionately. And I believe that because it impacted the LGBT community disproportionately, there were many delays in getting milestones or achieving milestones to curb the epidemic and to get the treatments to the right people earlier. But that's changing, and thankfully the people now live with HIV without having AIDS, or there are many other treatments that we could use, like PrEP, that prevents HIV. And the LGBT community is very vocal about preventing the spread of HIV, and has been very active with that, but recognizing that HIV impacts everybody, not just the LGBT community. And that brings me to the next point, which recognizing that an LGBT individual can get any of the other chronic illnesses that we see in our practices. So certainly it is very important to study and understand how the intersectionality of having an LGBTQ identity with other chronic illnesses, how that can be impacted. And again, like I was saying earlier, that if somebody is dealing with, I see patients who have inflammatory bowel disease. That's a chronic condition that lives with somebody for the rest of their life, and it has many implications on needing medical treatments, procedures, surgeries. And so it's a condition that, as I said, would be living with somebody for the rest of the life. And if you are fearing to seek care with your doctor, you might, because you belong to the LGBT community, you might end up coming with more severe forms of IBD. So that's why it's so important for us to study how the intersectionality of an LGBT identity impacts all these chronic illnesses, and helping us in achieving health equity for people with different chronic illnesses.
Thank you for sharing that, Dr. Chedid. Just, yes, the importance of, I think you said it so well, an LGBTQ person can get any illness. And so the
Exactly.
importance of treating, being able to hold space for that patient, no matter what your specialty is. And as you said, you mentioned your own work within gastroenterology, and I'd love to transition a little bit into that, to share your own sort of journey into medicine, and how your interest in advocacy within your specialty in gastroenterology, advocacy for the LGBTQ community in that space. How did that start for you?
Yeah, thanks for asking. So I started medical school back in the early 2000s. And as I said, went to medical school at the American University of Beirut in Lebanon. And throughout my years in medical school, part of why I went to medical school is because I wanted to do better for people. I seen a lot of injustices in my life growing up. I've seen a lot of inhumanity with growing up through wars, seeing people experience discrimination, poverty. And so going to med school to me was not only just to be able to sit in an office and treat patients, but it was to advocate for people and advocate for people whose voices cannot be heard or who do not have the space for their voices to be heard, or their voices are being silenced. As I always say, that us physicians have a big role in impacting how people are treated, and how the future of healthcare looks like, including eliminating several chronic illnesses that can be eliminated, or better treating many chronic illnesses that can be better treated, and providing it in an equitable and fair and just way that everybody needs to receive the care that they deserve. So as I went on, I moved to Pittsburgh, and during my time in Pittsburgh, I was at the University of Pittsburgh there for my residency. I was working in the inflammatory bowel disease research, and I was working in the intersectionality of mental health and having IBD. So I was very interested in the impact of having such a chronic illness on depression, anxiety, and suicidality, which is a very important topic to address and to recognize. And us gastroenterologists do not routinely screen our patients for mental health issues, and particularly suicidality, while we recognize, and more research is showing, that individuals who are impacted by chronic gastrointestinal conditions, and specifically IBD, can have worse depression, worse anxiety. And so we, as gastroenterologists, have a role, again, in recognizing such symptoms and getting people to the right care that they need for their mental health. So I did research in that when I was in residency, and then moving on to fellowship at Mayo Clinic, it was a life-changing experience. I'm so privileged and blessed to be at an institution like the Mayo Clinic, because I recognize that I'm training as a gastroenterologist. I'm learning all the ropes that you need to become a gastroenterologist, including like the pathophysiology of diseases, the procedures that you need to do, different clinical trials. But also, what Mayo provided me is with a space where I have a stage where I can continue to advocate, and you could be very creative with how you take your career. And so with proper mentorship and collaboration with so many folks around me, I felt that now I've reached a point where I can use my voice, and I choose to use my voice for the LGBTQ plus community, but I also choose to use my voice for all people and everybody who's from underrepresented or marginalized communities, because I believe strongly that this is how we can achieve health equity, by continuously striving towards it.
Well, thank you for sharing that powerful journey, Dr. Chedid. I love the ways in which you've kind of articulated how this call to medicine was also a call to advocacy for you, how you saw those two things going hand in hand. And in terms of this platform around the creativity that you had to create a space and to think about how you could do that advocacy within your work at Mayo Clinic and beyond. And one of the ways I think that has sort of manifested itself is in this inflammatory bowel disease clinic. And I'd love to hear a little bit more about the purpose of that clinic and how it has worked to sort of cultivate safety and access for the LGBTQI community.
Yes, thank you for that. So basically, as I said, like, it is very important that as physicians and as providers and as healthcare institutions, we have to make it visible that we are welcoming spaces, that we are spaces that are affirming for people from the LGBTQ community and are affirming from people of all walks of life, all races, ethnicities, and all marginalized groups. And in order to do that, you have to declare it. Because when you don't declare that you are an LGBTQ affirming space, people wouldn't know. And like I said, if somebody is suffering in silence, they're seeking online, they're searching for a doctor or a center that is LGBTQ affirming because of all their history of stigma that they might have faced in healthcare before. So they are probably afraid to go to any place that doesn't actively declare that we are LGBTQ affirming. And I've seen several patients in the IBD clinic who belong to the LGBT community, whether they are gay or transgender or lesbian or whatever their identity was. I've seen several patients who have expressed to me stories. I recall somebody who has been denied care, and when they came to us at Mayo Clinic, their Crohn's disease was quite severe by the time they came to us because they were denied care locally. And that person was like, I wish there was a clinic that looked at patients who have IBD and belong to the LGBT community in a way that is affirming to them and that provides them with that safe space. And so I was like, let's look and research. Is there anything like that out there? I know there are several LGBTQ plus centers across the country in certain spots. For example, in Stanford or UCSF, they have a LGBT health center, which provides more primary care. But I've not seen subspecialty clinics that specifically focus on LGBTQ plus health. And I know that somebody who has inflammatory bowel disease and belongs to the LGBTQ plus community might have specific questions or specific care needs that we can better address, but we don't know what we don't study. And this has not been researched before. And so all that together, the fact that there's no prior subspecialty clinics that focus on LGBTQ health and IBD. And there's not much research that we understand the impact of the identity on this chronic illness. I came up with the potential of how about we try to create a space that is an affirming space that we will call the IBD Pride Clinic. And I brought it up to my administrator. His name is Stephen Fisher at the time. And I brought it up to my chair of gastroenterology and vice chair, Daryl Pardee and Laura Raffles. And I got direct support. And they thought this is such an amazing idea. And we wanted to see how can we make it happen. So it took a little bit of time. It took around 2 years of researching how can we make it happen, how can we implement it in our scheduling system that folks who are belonging to the LGBT community can opt in to be seen in the IBD Pride Clinic, but not everybody who belongs to the LGBT community who has IBD will be scheduled in that clinic. They can just opt in, which I thought is a great idea rather than forcing everybody who belongs to the LGBT community to be scheduled in the IBD Pride Clinic. Because we do have the IBD clinic where all my colleagues are very well capable and well versed in taking care of all patients, including all the LGBTQ plus patients. So the special point of the IBD Pride Clinic was more as an outward visibility and declaring to the LGBT community who has IBD that we have a safe space for you. If you are in the IBD clinic at Mayo Clinic or in the IBD Pride Clinic at Mayo Clinic and you belong to the LGBT community, you are going to be treated the same and you are going to be honored. The only point of the IBD Pride Clinic is to declare to the world that we have that safe space for you and we are ready and welcoming and wanting you to come seek your care with us in a safe, affirming space. And we strive to keep your needs at the center of all our endeavors, just like the Mayo Clinic always says that the Mayo Clinic value is the patient needs come first.
I love that seemingly sort of small thing. You started with it as you were answering, this question about being intentional, this declaration, this being declarative, and how that's important. And I think sometimes when we're trying to make space or we're thinking about these issues, how we tackle these big issues, we're like, oh, I don't want to exclude, or I don't know how to be inclusive or affirming in the right way. And so I think as you sort of shared just the growth of the Pride Clinic, the IBD Pride Clinic, this sort of the outward facing part was so important. It was such an important part of that process of conducting that outreach and engaging the community to think about it, and that there's choice too, right? That the care is going to be, the care, your care will be held and you will be honored in those spaces, in both spaces, but this one in particular is for you, right? And it's that declaration that really has stuck with me in terms of thinking about other areas in which the advocacy work is being done, and the importance of being able to be very clear and intentional about the space that you're creating for the community. I think sometimes also in conversations around health disparities and inequities, it can feel very disempowering, right? It could feel like the issues are so insurmountable. And all of what you're doing, the space that we're providing here in this podcast too, is about thinking about the ways in which we can all feel empowered, patients, providers, support, everyone around. In terms of patients, how can patients feel more empowered? What resources are available for LGBTQ patients to advocate for themselves or loved ones who are facing discrimination based on their sexuality, gender identity, and expression?
Yeah, it is a lot. Like you said, there's so much that we feel like we want to change. There's so much injustice around us, but we chip at it one at a time. And so for somebody who belongs to the LGBT community, they have that gut feeling, that instinct. They recognize when somebody is discriminating against them. They recognize that microaggression. They know what it feels like when somebody is intentionally misgendering them or intentionally not honoring their identity. So I always tell somebody, trust your instinct, trust that gut feeling. If you are feeling uncomfortable or feeling that you are discriminated against during a healthcare encounter, then you probably are. And it's probably better for you to try to seek care elsewhere, or it might be important for you to see what avenues that healthcare center has for the patient voice, like a patient experience office, which is something we have at Mayo Clinic. I empower you to go speak up and say, I feel like I'm being discriminated against. That is very important, to advocate for yourself. Because when you openly advocate for yourself, it highlights blind spots that some people might have. And that highlights important elements that specific center might need to work on, whether further cultural sensitivity training for their providers or their staff, or further changes in their system that makes their space more welcoming. So again, trust your instinct, advocate for yourself, use the venues that the institutions have for patient experiences and patients' voices, because those are really important places. try to seek LGBT affirming providers. You can look at websites, whether institution websites might state who is an LGBT affirming provider, or there are other online directories that folks can look at LGBT affirming healthcare providers. Find support groups that are either from your chronic illness support group, like IBD support groups, for example, like the Crohn's and Colitis Foundation, or I could name several support groups. I know an advocacy group called Girl with Guts. That's a group that is very queer friendly and LGBT friendly and IBD focused. So there are so many advocacy groups or support groups that you can join to find people who are going through the same experiences as you are.
Thank you, Dr. Chedid. We've primarily been talking about patients, but we also know that there are unique challenges that are faced by LGBTQI trainees and staff and faculty. What are some ways that trainees, faculty, staff can seek support, and how can allies work to create an inclusive and affirming culture for their colleagues?
That is also extremely important, because when you are part of the LGBT community and going through your medical training or going through any of your training to become a healthcare provider or a physician, there are so many additional obstacles or difficulties that you might face, similar to what patients face. So stigma, discrimination, or not being honored by your identity. And so probably going back several years, there have not been like many LGBT friendly advocacy groups within medical societies. So folks who belong to the LGBT community who are in medical school in the past had to hide their identity many a times. And then that's how they passed through all the medical training and then became physicians. And I know folks who are much older than I am who have never come out in their life and have hid their identity from their colleagues, from their trainees, and kept their personal life private from their professional life, and thinking that's how they could pass through. But we also know that when you're not at ease or not out with your identity, that can increase your risk for depression, anxiety, and can increase risk of suicidality, which is a very serious issue amongst physicians. So imagine if you are also unable to be your true self or authentic self at work and show up as your authentic self. That worries me. That increases all the risks of, as I said, depression, anxiety, but also increases risk of suicidality. And so creating affirming spaces for physicians is very important, and creating affirming spaces for medical students is very important. And as a medical student, when you see somebody who's more senior than you, who belongs to the community, who's advocating, who is out and proud and is doing research in these fields or in LGBT health equity, you probably will be like, I can be that person. And if you don't see somebody like that, you probably feel, I should stay closeted, or I should keep hiding because this is how I could pass. And there are different specialties that are more LGBT welcoming than other specialties. There are more rigid specialties that are very rigorous, and you probably feel that I need to hide in them. More than other specialties that might be more affirming. But at the end of the day, the wave is changing, and I'm seeing a lot of advocacy groups that are growing. It's very refreshing to see, whether in surgical specialties, I'm seeing groups that are LGBT, orthopedic groups, ENT groups, or I'm seeing in pulmonary LGBT sections in the pulmonary societies, OBGYN societies, and as well as the GI societies. Now we have an advocacy group within our GI societies called Rainbows and Gastro. It is a group of LGBT gastroenterologists who got together and created that safe space for advocacy for trainees, for physicians, for patients. And by creating these spaces, it allows these medical trainees or undergrads to recognize that, hey, I could be that person. And they can connect with these groups for mentorship, for research, for networking, helping with finding future jobs. And I think this is very exciting, and it is going to be changing the way the field and the environment we live in, and it's going to be more affirming.
Thank you. Thank you for sharing that sort of powerful and refreshing note around the change that's happening too, that you're seeing. And of course, we know, I mean, the studies show that when you have, providers that are feeling affirmed and have a sense of belonging, and are also represented, right, that also translates to better patient outcomes and all of that. So it's this beautiful sort of ecosystem and culture that we're trying to change here. So thank you so much for your work in this space. And thank you so much for joining us today, Dr. Chedid. You've shared such important perspectives on LGBTQI health and health equity. And the LGBTQI community encompasses so many identities and experiences and lived realities. And you provided us with some really key ways to think about how to cultivate more inclusive, affirming, and safe spaces and cultures. Your work with the IBD Pride Clinic is a model for how that work can look like in medicine. And we again appreciate your role in this vital work, your advocacy, and of course, your story.
Well, thank you so much, Nicole. This has been so refreshing and exciting, and I'm really appreciative that you had me on this great podcast.
Wonderful. Thank you, Dr. Chedid. And that's all for today's episode of the Rise for Equity podcast by Mayo Clinic. I'm your host, Nicole Nfonoyim-Hara, and I hope you'll join us for our next episode. We'll see you then.